In this lecture, we talk about drugs for neurological disorders, those of Parkinson's and Alzheimer's disease. Just a touch on Parkinsonism, pathophysiology. There are issues with dopamine, acetylcholine, and GABA. A lot of times, as far as medications are concerned, we'll use anticholinergics and dopaminergics. Dopamine agonists, sometimes MAO-B inhibitors, sometimes COMT inhibitors. An example of an anti-Parkinsonism anticholinergic med is benztropine, which is cogentin. It treats drug-induced Parkinsonism or pseudo-Parkinsonism. It inhibits acetylcholine release, so that is the anticholinergic definition. Nursing intervention, we want to take vital signs. We want to watch urinary output. We want to increase fiber and fluid. No alcohol, cigarettes, caffeine, or aspirin. People can have chewing gum to help moisten their mouth. And sunglasses are pretty helpful with this one because people can be light sensitive. Another anti-Parkinsonism drug is a dopaminergic. An example of this would be carbidopa, levodopa, or Sinemet. It is converted to dopamine. The side effects, lots of anticholinergic types of side effects, but some other ones. People can get fatigued and have insomnia, so they can have both ends of those equations. Dry mouth, blurred vision, orthostatic hypotension, palpitations, and dysrhythmias. There's a missing R there. Urinary retention, nausea, vomiting, dyskinesia, depression, and psychosis. Dopamine agonists stimulate dopamine receptors, and they can be taken with the levodopa. An example of this is amantadine or Simitrel. A lot of anti-Parkinsonism drugs, when we look at this, we want to let people know the drug may be taken with low protein foods, but you don't want to overdo it on the protein. And then food does slow the drug absorption, so you don't want to take it with food. High protein foods interfere with a lot of the metabolic processes that are needed with this. So a conservative amount of B6 is needed to prevent a B6 deficiency in patients taking this. Abrupt discontinuation can cause rebound Parkinsonism. And then some nursing interventions you might want to watch for here are monitor for orthostatic hypotension, administer drug with a low protein diet. Do not abruptly discontinue. Warn of harmless brown discoloration of the urine and sweat. Assess for suicidal tendencies and assess symptom status and on-off phenomena. Monitor blood cell counts, liver, and kidney function. Also, let the patient know that the discoloration in the urine may stain their clothing. Patients are usually very grateful that you've told them about this. A thought to think about, we should give Parkinson's drugs on time. Otherwise, we have some on-off phenomena that happen, and we can also have a little bit of an overdose if they get them too soon. So we want to make sure we're giving them on time, stay within that half-hour window. When we talk about Alzheimer's disease, just a tiny bit of pathophysiology, people end up with degeneration in the brain with neurofibrillary tangles and neuritic plaques. Alzheimer's meds, some are acetylcholinesterase inhibitors, cholinesterase inhibitors. These are things like donazepam, which we spoke of in class. So they slow acetylcholine breakdown and promote acetylcholine binding to receptors. So we can consider them cholinergic. Some, including Excelin, can slow progression of the disease process. We'll watch that unfold as research unfolds in front of us in our lifetimes. Thanks for joining me.